Hey guys, thanks for taking the time to watch and listen to my presentation. I know we all have busy schedules, so I'm going to try to keep it short for you guys, but I just wanted to talk to you guys about safe and effective use of new technology. And the reason why I chose this topic is just from my experience, not only this unit, but previous units that I worked on. I feel like there's always a little bit of resistance, a little bit of pushback whenever something new is rolled out to us. So I just want to talk to you guys about some of the benefits of this new technology that is being rolled out. So I did a little bit of research and I found a study that was done in Australia and it surveyed two different hospitals, specifically the nurses that work there, on how they felt about new technology whenever it was introduced to them. And there's a significant difference in both these hospitals. In Hospital 1, the nurses had a lot of resistance, reluctance to new technology. In the adoption process, they felt like it was threatening the clinical skills and it was slowing down their work. Um, Adding on to that, they felt like um, they are unable to give as much psychological care because they feel like they're stuck behind a screen. They get frustrated, especially in the beginning. And these comments definitely is not the first time I've heard of them. Just from talking to nurses, I feel like there is a lot of negative attitude whenever something new is rolled out to us, but I think it's important that we at least give everything a chance because there's definitely a reason why these new technology is being rolled out to us or introduced to us. So let's give let's give everything a chance, and it'll definitely help our patients. That should always be our number one priority. Like I said, a lot of us are reluctant to change or worried about our work efficiency, and a lot of us don't see the long term benefit, and that's the key right there. We need to look past the short term and how it's affecting our workflow and see how, in the long run, it can actually help us, not only us, but our patients, number one. So, and some of the benefits to new technology include improved patient safety, which is always our number one priority, promotes optimum patient outcomes. And like I said, in the long run, even though it can slow down uh, our workflow right now, uh, in the long run, once we build those habits, it may actually help to improve our workflow. It can also help give better overall care for the patient and also improve our communication. These are just some of the benefits, but I actually also researched something that's not being used in our hospital that can help our communication tremendously, and I'll talk to you guys a little bit about that in a later slide. Here's some examples of new technology. There's genetics and genomics. There's a lot of new therapies coming out and treatments coming out that are based on genetics and how we can use these genetics to help improve our patients' overall outcomes. Obviously, we're familiar with the robotics surgeries, and it's less invasive, more comfortable for the patient. Um, Also, less invasive and more accurate tools for diagnostics and treatments. Those are all beneficial to our patient and can lower the risk for them and lower the cost. And here's some more examples. Electronic health records, we're all familiar with that. We're able to access a patient's information 24-hour a day, 7 days a week, so there's no delay in their treatment. And we all know that uh, time is definitely important when trying to help our patients. Also, there's computerized physician provider order entries, and those can also help our clinicians make decisions. And there's a lower cost, reduce medical records, and it's based on the best evidence-based practices. And here's some of the technology that is more specific to nursing, And the Vocera is what I was talking to you guys about earlier. Basically, it's like a little phone that you wear around your neck, and at a touch of a button, we're able to contact the physician or nurse practitioner, whoever we need to. If there's something wrong going on with our patients. It also can be used to communicate with family members. I thought it was a really cool piece of technology. I don't think it's being used through St. John system, but I have heard in other hospitals in Michigan that they're using it. So if you guys have the time, I would recommend researching it. I thought it was really cool to see. Another thing that I saw was wearable technology. Uh, One of the things that I learned from my class is that one of the nurses in my class, on her unit, they have wearable technology uh, where they can actually move around the unit without being tied down. They actually have blood pressure cuffs that are portable, and telemetry monitors that are portable, and pulse ox monitors that are portable, all in one. So I thought that was a really cool system that could definitely be utilized on our unit, so that the patients don't feel like they're tied down all the time, help improve their mobility. And also, obviously, we're familiar with the infusion pumps. We just have the new software that got introduced to us recently. Um, and I know it can be slow at first, but definitely in the long run can prevent medication errors, and that's always our priority, is safety. And I was talking to you guys about Hospital 1 earlier in the study, and this is the attitude of Hospital 2. They felt like it could improve their clinical knowledge. The nurses felt like it was improving their attention and decision making processes. They had increased motivation. They felt like it actually improved their skills, not make them worse. So um, there are times, like some of these comments are saying, that there are times that all of us need to be reminded of something. If it's something that an intervention that's a long process. I think one example they were talking about was wound care, all the supplies that we need, all of the steps that we need to take to prevent infection. So I thought that would something that technology could help us with. Um, so in conclusion, basically, I feel like we should try to share the attitude, specifically with Hospital 2 of the study. Always give everything a chance. And not everything always works out in the beginning. There might need to be some tweaks, and sometimes the technology um, won't help uh, in the long run. So they might need to change it, but we should always give everything a chance, and maybe it could actually improve not only our workflow but our patients. Number one, and like I said, there's countless benefits to it, and our patients are always our priority, and technology helps us to take care of them. So that's it. Thanks a lot, guys.